Now I'd like to invite our first group of speakers today, our focus group presentation from our community perceptions and precision health.
Okay, good afternoon, everyone, and welcome again. We're really glad that you're here so that we can share some of our progress, but also some of our vision for the future. So my name is Lisa Goldman-Rosas, and I'm the lead for the consortium core that I met some of you at our table, and as well a co-investigator on the lead for the implementation core and a co-investigator for the consortium core. I think I know who I am by now. So it's really the goal of our two cores to engage our community partners to inform practical applications that come out of the research projects that you'll learn a little bit about today to ultimately address health disparities. No small task, but one of our first projects we're going to present today that is towards that goal. So we were really lucky to have a wonderful team to support the work that we're going to talk about today. You can see in bold the speakers that will join me up here in a few minutes, one by one, who will help to present the work that we've done. So we have Dr. Todd Park, who was with San Jose State when we started the project and now is on faculty at UCSF. We have Dr. Owen Garrick with Bridge Clinical Research, Ysabel Duran, the CEO and founder of Latinos Contra Cancer, and Jan Vasquez, the Research Director for Pathways to American Indian and Alaska Native Wellness. And I just can't emphasize enough how grateful we are to those community partners for the work that they put into this. We really are so lucky to have such strong community partners working as part of SPHERE. Okay, so a quick roadmap of our presentation. We'll give you some rationale and objectives for the project. I'll describe a little bit about the study design, and then each of our speakers will come up and share some of our preliminary results from our project, and we'll end with a conclusion. So I think we're all here today because we recognize that precision health holds kind of great potential for revolutionizing health and health care. Based on a better understanding of the complex interplay between biologic, behavioral, environmental, and social factors that ultimately affect health equity and health inequalities. However, this precision health movement, if you will, may widen disparities if barriers prevent certain populations from participating in the research and then gaining access to precision health approaches that may stem from that research. So for SPHERE, a really critical first step was engaging those communities to better understand their views and ultimately shape our research agenda. So with that, we embarked on this first small research project, the objective of which was to engage diverse communities, and specifically we focused on Chinese, Vietnamese, American Indian, African American, and Latino communities, as well as the providers that serve those groups, to better understand their views on precision health and precision health research. We chose those groups because they were the priority populations of the 3 research projects that are involved in SPHERE. Then the ultimate goal was to utilize the findings of our project to inform the development of a set of best practices or ethical guidelines that will ultimately guide the research that SPHERE engages in, as well as community outreach and education strategies. So to engage those 5 diverse racial ethnic groups, it was really critical that we depend on our strong community partners. You can see these leaders and community partners here in this table. Each one of them was instrumental in engaging their local communities, Chinese, Vietnamese, American Indian, African American, Latinos, as well as providers, so we could better understand their views on precision health and precision health research. We used focus group discussions as well as surveys to address our research goals. I want to point you towards those abbreviations we have there for each of the racial ethnic groups, because as we present quotes from the focus groups, you'll need to remember those abbreviations if you can. We conducted 2 groups with each of the racial ethnic groups, and for Chinese, Vietnamese, and Latino, we conducted them in English and the native language to better capture the diversity of views out there. Each focus group was guided by a trained facilitator using a focus group guide that we developed jointly with our community partners. Then each focus group participant also completed a survey prior to starting the focus group that assessed demographics, which was important for enabling a future mixed methods analysis for our focus groups, as well as a quantitative assessment of knowledge, attitudes, and experiences with precision health. To supplement that, we've been conducting key informant interviews with SPHERE investigators as well as our community leaders to ensure that the ethical guidelines and best practices capture the diversity of views that we have on precision health and precision health research. So we just completed our 12 focus groups, the transcription of which and the translation for the non-English ones, and started our thematic analysis of the 12 transcripts. We developed the codes and themes in partnership with our community leaders that took part in this project, and we'll be presenting the preliminary results of the thematic analysis today. Okay, on to the results. So in total, 115 community members participated in our 10 focus groups across the 5 racial ethnic groups. And I think for our group that engaged these community members, it's really important for us that you understand kind of the diversity across groups, but also within groups. We chose these demographic and socioeconomic characteristics to show you because these are the ones we anticipate using for our mixed method analysis, where we better understand how views may differ according to these variables. And you can't see it here, but 70% of the participants on average were women. So we're going to be presenting on these 5 emerging themes that came out of the focus group discussions. Each one of our community partners will present 1 or 2 themes in one case. And you'll see this table as we move from theme to theme. So for example, for the first theme, you can see the salient implications for both the best practice and ethical guidelines, as well as the outreach and educational strategies. So for theme 1, for example, we learned that simple definitions for precision health were really important for increasing the reach of our messages, and then also that we need to be tailoring our messages to account for the kind of incredible heterogeneity that's out there in terms of understanding of precision health and precision health research. So with that, I'm going to pass it on to our first speaker, Dr. Todd Park.
Thank you, Lisa. Can you hear me? Yeah. Again, I'm Todd Park, and I'm at UCSF now, effective July 1st. But I was at San Jose State for 8 years. So, as Lisa mentioned, I will be talking about the first theme as it relates to the knowledge and attitudes about precision health. So we asked the focus group participants across all groups how much they know about precision health. Is that better? And the majority of them reported that they were not familiar with the term precision health. And as you can see in the graph there, the range was 64 to 91%, with 64% from the African American community and 91% from the Chinese participants, who reported that they had no knowledge of precision health or limited knowledge of precision health. And as Lisa mentioned when she talked about the summary of theme 1, the participants prefer to have a simple definition of precision health. We had provided them with 5 different definitions of precision health, and across all groups, they reported or they preferred the very simple definition as the one you see here. And it states it's a way of dealing with disease prevention and treatment that takes into account people's individual differences in genes, environment, and lifestyle. And it's very short, that's what the participant said, and it's very straight to the point. The other definitions that you don't see here had some of the terms that were used included socio-ecological approach and ethical implementation and surveillance data. And so those were terms that the community felt they weren't familiar with. And for some of these definitions, they were lengthy as well. So again, unanimously, they preferred the very simple and to the point definition. So there were also some other similarities across the groups and in terms of their understanding of precision health. Across all groups, they understood that it's used for screening, prevention, and treatment of diseases, and that it's related to our genetics and or ancestry or race and ethnicity. But the important point to really emphasize here is that they also mentioned across all groups that, hey, other things matter too in terms of our health. Other factors affect our health, including the environment, neighborhoods that people live in, our socioeconomic status, and whether or not you have healthcare insurance, and health behaviors, our diet and lifestyle. Some other additional factors that the participants reported that affect our health include education, psychological well-being, culture, gender, and access to healthcare services. We picked out some really great quotes from our participants, as you see here, and hopefully you remembered the abbreviations of the groups. For psychological well-being, for example, a Vietnamese participant stated, "When people live in poverty, they neglect their health. They're very stressed, and they live in a very stressful environment." For access to healthcare services, an African American participant stated, "If you are white, you will have greater access to what might be causing what you have, and greater access to how to fix it, if it's fixable." And overall, there were both positive and negative attitudes about precision health. In terms of the positive attitudes, participants reported that they understood that it can detect diseases in an early stage, that it's also personalized, or it can be personalized medication and treatment. And interestingly, also that there's a new direction about precision health or about medicine moving forward. So you can see here a quote from a Latino participant stating, "It will help our future for our kids and our grandkids and everybody else." And I think what's really important to highlight here is the fact that the family unit is really important for our communities. And so in the future, as we're thinking about interventions or programs, we need to remember this, that the family unit is really important. And finally, you can see here the negative attitudes towards precision health. Not surprisingly, if it's expensive, that's going to be a barrier. If they don't have healthcare insurance that covers it, it's going to be a barrier as well. And I want you to draw your attention to the last bullet, which is a quote from an American Indian participant. "I'm like suspicious of continued genocide. It's definitely paranoia, but it upsets me." And I think it's important that we all remember how all our participants feel in the history of our communities as we move forward towards this adventure together. And Dr. Owen Garrick now will come on up.
All right, I'm Owen Garrick, and we'll talk a little bit about genetic testing knowledge. And as Van mentioned, our patients or people in the community, subjects, research participants, don't just look at this from a scientific perspective. Right? They think about it in the context of what we now call social determinants of health, or within the context of a belief system. So let's start with some good news. There was generally greater percentages of knowledge around genetic testing. Now, sometimes, given, celebrities have their life under a microscope, so often highlights some of their deficiencies. But one of the good things that Angelina Jolie did and help around, I talked about personally and publicly her issues around breast cancer, and that we saw people knew about that, and that really helped highlight this idea around genetic testing. It wasn't consistent across all communities, but we certainly saw higher numbers. I kind of thought, well, maybe if we can get one of the Kardashians to really take on this issue, we might be in a better shape. It didn't have to be one of the major ones like Khloe or Kim, but maybe a Rob, or if there's like a Beatrice Kardashian somewhere, we may be okay. All right, so that's the good news. But if we dig deeper, there's certainly some variability within group and across groups. So you range from having some really specific scientific knowledge, say the U.S. Public Health Service syphilis study, to misconceptions that if you check your genes, that will, somehow bad things might happen. And then certainly, as I mentioned, this issue of social determinants. Even if there was an understanding about it, there's a thought of, it really may not matter because the infrastructure, the environment, the healthcare ecosystem in which I reside can't afford that, won't have that anyway. So if we continue around this idea of perceptions, there are some recognized advantages. Screening, prevention, treatment of disease, and also a specific focus, because a lot of these tests happen with newborns. So the African American population in particular gets screened for sickle cell disease. So people understood that. And so there are things that are already happening in everyone's life that you can help to better explain some of these issues. But if we look at some of the risks or the disadvantages, and here the quote, I think, gets back to this idea of people don't look at themselves as study participant AB156, right? They want to be respected. They want to be included. They want to feel that you as a researcher have an interest in them as a person. All right, so if we continue around some more of the beliefs, and these are more beliefs within a person and how they might translate to their perception, their willingness to, or their understanding of genetic testing. So there's, especially if you looked at American Indian and African American populations, this confidence around their resilience because they've been oppressed for some amount of time, and they feel they can often bounce back. There's certainly in the Black community this remembrance, right? This recollection, even if they don't know all the facts. There's this, this thing in the back of their mind about historical experiences. Certainly, if we look at the Chinese population, and I think this example is good for all populations, involving the elders in the community, those that have a standing, because they might have a more deep-seated perception that needs to be dealt with. And then finally, this issue of faith and what it means, right? A belief system where if it's in God, if God has the plan for your life, it will happen. So we have to think and be aware of this perspective as well. All right, so let's look a little bit more into the numbers around belief. When we specifically asked the question, or do you agree with the statement, the use of genetic tests could lead to discrimination? We asked this question because there's a fair amount of mistrust. So very surprisingly, well, maybe not surprisingly, there were some thoughts around this issue of discrimination. It wasn't, I think many of us went into it thinking that some of these numbers, more the blue numbers would hit 80+%. So we were somewhat pleasantly surprised, but given that there still wasn't as much knowledge, there was a lot of response of, I'm not sure. And then finally, attitude. So you see a very mixed picture. Sometimes lack of knowledge, sometimes a misperception, but still, even in the face of that, an interest in potentially participating in genetic testing, given some of the rationale. So interestingly, all of the subpopulations, with the exception of Latinos, mentioned, something in particular that would get them to participate in genetic testing. Latinos did not have anything specific. With that, let me turn it over to Ysabel to talk about participation in research.
I'm Ysabel Duran, and I'm with Latinas Contra Cancer. And my team is back there. They can raise their hands. They were all very, there you go, my team, that helped pull this together. Can't do it without the team, right? And I'm really thrilled that Stanford decided to engage in this because we've been dealing with researchers for about 7 years now. And I think it's really crucial to make sure that the communities are not afraid of the science, and they can only lose that fear if they get up close and personal with it. I'm also glad that this project evolved because it has captured the feelings and beliefs, I think, of our disparate communities. And two, and you heard it with Lisa to start with, because of the concerns of these communities as expressed in these findings, that if they're not addressed, and I say this, if they're not addressed by research in the healthcare system, precision medicine is going to, as Lisa mentioned, exacerbate the disparities already experienced by most of them. So we're turning to the key concerns, which is when asked about their future attitudes towards precision health and undergoing genetic tests, we wanted to find out those fears and those concerns. And so number one, you'll see under security and confidentiality of genetic information. There were varying fears, but I'm not surprised. How are the insurers going to use our information? Internet computer hacking, they do think at a high level, is an issue, also not uncommon even in the mainstream. What would happen if employers get access to their testing outcomes? And in some cases, could researchers be trusted with the information? Number two, the second concern was about affordability and access to genetic tests, and indeed, access to care that utilizes this cutting edge we call precision medicine. If they can't get to step one, they'll never get to the next step, which is the utilization of the science. Discrimination was a huge concern, measured in different ways. Would information be used to discriminate against groups? Or would they face further discrimination in care as a result of costs and lack of access to the testing and the treatment? And then, of course, the big one, lack of trust. This is the fourth. It's also the most critical concern, and it underlies the three preceding points, because in some communities, this very deep level of mistrust goes to long-held grievances of abuse of communities by researchers, and why, for instance, in some communities like the African-American community, you're going to hear, even to this day, despite the fact that you've got a young group, a younger generation, you still hear Tuskegee come up quite a bit. And so it's really important to be sensitive to those issues. The trust issue is reflected in various patterns across the 5 racial groups. With this is a more detailed breakdown. From the Chinese, Vietnamese, and Latino respondents, we learned they're more likely to trust their physician. So this is on one area. And a crucial reason why providers use become proficient. I think that the physicians need to become proficient in, oops, am I looking at the wrong thing? Did I go backwards? They do say they would agree, they would participate, but they depend on guidance from their physician, most of these groups. And I think, therefore, it's crucial for clinicians to come up to date on genetics and on precision medicine, because most of them don't understand this new medicine as well, so it's important. The same group trusts researchers if they get enough information from them to be able to make an informed decision. And I think that also builds that communication and trust between those. For African Americans, bottom line, the trust only African American researchers, which is very telling. Their concern to some extent reflects the history that we hear over and over again around research, despite the fact that some of the Black participants, as I mentioned, were some of the youngest in the study. And among American Indians, they only trust physicians to a certain extent. On the mistrust side, from American Indians, pharmaceutical companies have no trust there at all. And more pointedly from African Americans and white researchers, that's going to be a long bridge to move towards. There's an aversion to sharing the bodily fluids for the sake of testing, that negative attitudes to participation, taboo and evil. That from the American Indians, a doubt about benefiting from the results of research studies. Older generations had negative attitudes towards participation in research. and not familiar with research and lower level of education in the Vietnamese community. Once again, education is absolutely crucial. For some of the participants, willingness to participate, if they have enough information, sure that the information will be secure and confidential. Study is not experimental. They're not required to provide blood samples, so that's a high bridge to cross. And physicians ask them to participate. So that's it. Thanks. Jan Vasquez, you're next.
Okay. So I'm Jan Vasquez, the Research Director for Pathways to American Indian and Alaska Native Wellness. And I'm going to be talking about community outreach, focusing on increasing public awareness. Let me try this. And educational strategies. There we go. Okay. So participants across the 5 racial groups discussed the need to increase public awareness and about precision health and genetic research. And so here we've listed some of the strategies, educational strategies. And we have some quotes also. So one of the points here is American Indians stress the use of lay language for public education, which is, as a community researcher, I very much understand. Research is like a whole different language. So that one makes total sense to me. For Vietnamese, they suggested that education should be delivered in their native language. And Chinese highlighted the importance of reaching out to older generations and emphasizing that their information is private. So all very important. Okay. So participants were then asked to recommend strategies for increasing awareness about precision health within their communities. And as you can see, there are many different and creative strategies. Chinese, Vietnamese, and Latinos recommended the use of ethnic media to outreach to their communities, primarily TV and radio. American Indians and Latinos suggested social gatherings such as powwows or health fairs, while African Americans and Vietnamese suggested that workshops and focus groups would be good strategies to outreach to their communities. Okay. Whoops, I'm sorry, not quite. Participants were asked for strategies to engage their communities in precision research. And some of the examples there, hiring research with diverse backgrounds was important. Ensuring that study results are not generalized from whites or other ethnic groups and minority groups. So what works for one group won't work for another. Another recommendation was to reach out to hard-to-reach groups. For example, distance can be a critical barrier for American Indians living on a reservation, or that they may have limited or no access to internet. So it's just important to take these kinds of barriers into consideration when outreaching to our communities. Participants thought that it was important to ensure clear laws to protect them from discrimination, which is very understandable, and some of the things that Ysabel mentioned, that there are so many historical examples of unethical research that has happened in our communities and conducted with our minority groups. Another recommendation was to make sure that participants within each of the racial ethnic groups are recruited. For example, there are 566 federally recognized tribes, and all the tribes have different cultures and traditions and beliefs and attitudes. So it would not be good to lump those together. Similarly, would be the many different peoples grouped as Latinos, Cuban, Mexican, South American. It would not be good to lump these groups together. So there's no homogeneity cannot be assumed. And finally, in order to capture the variability between generations, it would be important to encourage participation across the life course. And I will invite Lisa back up to do some summary and conclusion. Thank you.
Okay, thank you so much to each of you for sharing some of our results. It's hard to distill down to 30 minutes what was such an engaging experience talking with all of these community members throughout the Bay Area. So I'll just go quickly back through the themes. So we went over the 5 themes around precision health knowledge and understanding, and I think we learned there about the importance of short, brief definitions. And then Dr. Garrick, excuse me, shared with us people's views around genetic testing and some of the importance that they hold for both genetic testing as well as the economic, social, and environmental context in which they live. Theme 3 was focused on people's participation in research, specifically precision health research. And we understood there that historical injustices, particularly in the African American and American Indian context, really still shape people's decisions about willingness to participate in research. And another thing we learned there was that clear communication that addresses people's fears and concern is critical to engaging them in the research process. We learned about the 4 important fears and concerns that came from all 5 groups, actually. And then finally, people's ideas for how to outreach into these communities to increase awareness around precision health and engage the different communities in precision health research. Our next steps for the Consortium Core and Implementation Core are to complete the analysis of the focus groups with our providers. So we've completed the initial analysis with community members, but providers were that 6th important group for us to focus on. And then to integrate the demographic and socioeconomic data that we shared on the characteristics of our participants to understand how opinions and views may differ across those variables. Then we'll be using that information to develop our best practice and ethical guidelines, as well as going out and pilot testing some of our outreach and education strategies. That's it. Thank you.
Thank you all for participating and helping lead this community perspective process. I wanted to announce earlier, and I forgot, that we will have a question and answer session at the end, so you'll have an opportunity to ask questions of all speakers.